If somebody is having malaria, even after treatment, you take the sample, you see the malaria parasite because you clear it at a time. So now that this thing is on ground, and this disease came up with so many other in this period. Lassa fever was on rampage, measles outbreak occur, conjunctivitis, they call it Apollo, is on the, and even the, what do you call it, the chicken pox. We have a lot of outbreaks in FCT here and there because the weather has changed and the bacteria is trying to mutate and change its position. That's why we have type C. Now people should be patient, should calm down. The main thing in meningitis is not only vaccination, it's prevention.
How do you prevent it then? Now
prevention comes with avoiding overcrowding. That's one. Trying to have cross ventilation is very key. Thirdly, you try to see that a high level of hygiene, particularly hand washing, is being implemented. When people are coughing and sneezing, because the virus is in the nostrils and then they should be able to cover their mouth, and so that they will not sneeze into the people's face. So it's very important that we have this high level of hygiene, particularly shaking of hands. We wash our hands after. It's not like during Ebola. Bacterial meningitis has treatment. UNICEF gave us 1,000 doses of the treatment and we distributed to all our hospitals.
Do you think that's why we're a bit lackadaisical? Because we know that meningitis has treatment. Because we saw what happened when there was Ebola.
There was no treatment.
There was no treatment. And we saw the campaign. We saw how, the federal government, the state government mobilized. Hand washing became commonplace. We saw, sanitizers being distributed. But after Ebola was kicked out, so also was the habit. Is it because, Ebola, we know that there's no cure, and these ones we know that, well, we can take medicine and get better?
I think in public health, one of the major things that will prevent outbreak of diseases, particularly infectious diseases, is hand washing. Hand washing is very important. Our hand carry most of the things. If we wash our hand before eating, after going to toilet, after going around, most of the diseases have been taken away from it.
Yeah, the question is, now we know hand washing is, one of the solutions.
Yes.
Why have we also kicked out the habit of hand washing? Why does it look like the primary health care centers are also not concerned about sustaining that campaign, and even perhaps the government as well, helping to sustain that campaign by providing water and even soap in general spaces?
No, actually, it's our attitude in Nigeria. Government cannot go alone and provide hand sanitizers in everywhere, even in the government facilities. But we should be able to maintain your own health yourself. When you are sick, is it government that is sick? You should be able to wash your hand with soap and water, or what do you call it, or ash. That's very important.
I'm just asking, would you carry your own soap and water around? You wouldn't do that.
What I'm saying is that I think in the schools, they started that in all our secondary school and primary schools. We insisted that they must provide washing basin for hand washing for children coming to school, because that's why when outbreak occur, it spread like wildfire in schools. And then also some people in banks provided hand sanitizers in some places, but it went away.
The question is, who's going around to ensure that this habit is sustained?
I think there is no law against. If there is law, we'll be able to say that you must provide this at the facilities or at your own company or your own schools or even hospitals or even government offices. There was no law backing this. So we only want to appeal to public to please make sure that we have that habit of washing of our hand, and please avoid self-medication. It's one of the things that is killing this country. Self-medication. People have taken drugs before they now rush them to the hospital. After look at those ones that came, the 6 people that died, all of them came at the dying minute. One immediately the doctor was, even a junior doctor was trying to crack. What is wrong with you? He's having headache. In Asoko Regional Hospital, that was having headache, fever. He was just trying to crack. He's a medical officer who is coming for housemanship. He was just trying to crack before he informed his chief. The man the child gave up. It's a girl. There are 3 girls and three boys that died, the 6 people that died. And all of them are ranging between 1 to 22 years, even the whole epidemic. We realize that the children that are affected, the federal government started vaccinating children between 1 to 29 years every 5 years. The one that is coming is supposed to be next year, but it started this year. The epidemic now came this year. So the government now to change pattern. Now we don't vaccinate pregnant mothers. We don't vaccinate children under the age of 1, meningitis vaccine. The meningitis A that is on our immunization schedule, we have to now remove it. We have to inform the public. Now we started informing the public on our pamphlet, trying to advocate to local government chairmen that we have, and to other places, to FCT administration, and to other all over the country. The National Primary Care distributed this pamphlet. Now we are seeing the outbreak of C. So now the government now are trying to see how they can procure the vaccine for A and C.
Okay,
so
just a quick response before we go to break.
Yes.
Do we have institutions who are researching to find out that perhaps we're a little ahead of these mutations or strains so that we can have our own vaccines developed or manufactured here?
I think where I can say that the government are really lagging behind is the issue of laboratory investigation and surveillance system and contact tracing. We're really lagging behind in that. Government are not investing in research. Government are not investing in the disease surveillance system. It's WHO that is supporting surveillance system in this country. I think government need to join hand and support surveillance system and contact tracing. By the time we are doing have a good surveillance system, contact tracing, and then we are reporting cases, I think all these things will be things of the past, and laboratory system are strengthened.
Okay, we'll go to break, but we did reach out to the Nigeria Center for Disease Control, but they say this morning they had an urgent matter, so they couldn't make it today on the show. But we'll take a break and we'll be back. Don't go away. Welcome back to Sunrise Daily. Speaking about meningitis, the spread and how to contain it. It's our concluding moments now. And when you raise some of those issues, it really gives people a lot of concern, especially when you say people are used to self-medication. When some of those symptoms happen, people should be careful. Just reach out, call. And, something's flashed my mind. Yesterday, we were out in the sun on a light, Gimba had headache under the sun. So now that you mentioned it, that we'll have to, maybe after the show, ask.
No, I just had paracetamol and it was okay.
Okay, it was tension headache.
There's
just tension headache.
No stiffness.
Is there any neck pain and stiffness?
There's no neck pain, there's no stiffness, there's no meningitis anywhere close to me.
He's got type A and type C vaccines. So
by the way, the rains are here. Because the rains are here, will it help?
The vaccine?
No, I mean when the rains are here, the weather becomes cooler.
No, when the rains, the epidemic will cool down, I said, when it's on.
Okay, but
the peak is in April.
But what's happening now? Have we received vaccines? Where are we reaching out to?
Actually, for example, in the government of Nigeria actually received 500,000 doses of these vaccines from WHO, the stock. And that's why they announced, they gave us only 5,000 doses in the FCT, and the rest were taken to 5 states, where they have confirmed cases. In the Zamfara State, Kebbi, Katsina, Niger, and Sokoto. They have started the vaccination yesterday, and they want to vaccinate some number of children there. Well, the government are also expecting 800,000 doses of vaccine from India. They procure, the National Primary Care, they procure these vaccines. They are actually looking for about 2 million. But it's only one company and one country that's producing the vaccine, India.
It's going to cost $1.1 billion.
$1.2 billion. It's a very big amount of money the federal government are trying. So I think we should give kudos to federal government for actually urgently procuring this. In the next 2 weeks, the vaccine will be here.
Just want to know, if you've taken a vaccine once, do you need to take it again?
There are certain vaccinations that you need to take more and more. Number one is BCG. When you take it, it doesn't prevent the tuberculosis. But you can get tuberculosis if there's any reason why you can get it, malnutrition, any other reason, HIV will come in. Second one is the yellow fever, and then the meningitis. That's why we are taking it 10 years. We need to repeat it after 10 years. It doesn't give combined immunity like other vaccination.
The tuberculosis.
Like polio, if it is polio, we give you polio, and we confirm that you have taken the vaccination, you will never get polio again.
The tuberculosis, tell us more about that one. How many years intervals do you give to give tuberculosis, and to what age?
That one is that it doesn't confer immunity, it just reduces the severity. It doesn't prevent you from getting tuberculosis. That's the meaning. Just like the case of meningitis, we have to repeat it. Just like yellow fever, we have to repeat it after 10 years. That's what I'm talking about. Like measles vaccination. We have given measles, doesn't mean that the child will not come with measles, but it tends to reduce the severity, the complication that will kill the child in the eye, in the ear deafness, in the eye. So this is the thing. So in meningitis, that's why we're repeating the campaign. As we are doing it after 5 years, some children are also born.
And they contract it.
And they have to give them the vaccine. We don't give children less than 1 year. the vaccine is contraindication in pregnancy and those who are seriously sick. So we are targeting children between 1 to 29 years is because we also know that their immunity is a bit low. After 30 years, you build your own farm immunity and God is protecting. So look at the pattern of the outbreak. Only 1 to 22. Okay. No one above that have died. No pregnant mother, no children under the age of 1.
All right, that's a good part of the whole thing. Dr. Rilwanu Mohammed is the Executive Secretary, FCT Primary Healthcare Board. Thank you for talking to us
today.
Thank
you very much, Anna.
And that's the show today. We thank you all for watching. We'll be back tomorrow. I'm Chamberlain Osol.
Oh, thank you. It's great to have you guys here at Abuja, at least for 2 days. I'm Maokbe Ogun.
And if you notice any stiffness in your neck or any pain, headaches, do the right thing. Get to see a doctor immediately. I'm Gimba Umar. Many thanks for watching.
Because you're speaking from experience.